Hey guys, today we're here with Dr. Arslanian, and he is going to break down the difference between a breast lift and a breast reduction. You ready?
Let's do it.
All right. What is the difference between a breast lift and a breast reduction?
Great question. Something that confuses a lot of people. There's not really much difference other than the amount of tissue that we're taking off. So a breast reduction is going to remove skin and then also a substantial amount of breast tissue. And then a breast lift is mostly going to be a skin removal, perhaps a small amount of breast tissue. But that's really the big difference between the two.
Good answer. Another common question we get is, do both procedures leave similar scars, or is there a difference in scarring?
So what I would say is for both breast reductions and breast lifts, there's usually 3 scar patterns that we use. The first one, which is the least common, is just the areolar incision. So it's just a circular incision that goes around the areola. Not many people are good candidates for that by itself, but sometimes it can be done. The second one is the lollipop incision. So that's the circle around the areola and then the vertical scar as well. I would say maybe 20 or 30% of patients can do that. And then the third type of scar is what we call a wise pattern or an anchor incision, which is the lollipop and then also that curved scar that goes in the breast crease. So both breast lifts and reductions can use any of those scar patterns. In my practice, with the type of patients I see, the breast sizes that I see, I would say about 70-80% of them are going to be an anchor incision just because with the amount of skin that people have and the amount of lifting that needs to be done, you need that, all 3 of those incisions. So
I feel like that's just like the top question too.
Definitely top question.
Mm-hmm. Okay, moving on. Okay, so how do you determine if someone is a good candidate for a breast lift or a breast reduction?
So in both cases, the patient's got to have what we call ptosis, which just means the breasts have gotten a little bit droopy. The nipples are sitting lower because in both procedures, we're going to lift the breasts. The difference really comes down to, I ask patients, when you wear a bra, a nice supporting bra, are you happy with the size of your breasts at that point? If they say, yes, I'm happy, then they're a great candidate for breast lift. If they say, no, they're just too big, then they need a breast reduction to decrease the volume size. And if they say, actually, I wish I was a little bit bigger, then we would probably do a breast lift with implants.
Okay, perfect.
I know.
Okay, next question. Can you get a breast reduction and a breast lift at the same time?
Another question everybody always asks. So what you can say is all breast reductions are at breast lifts, but not all breast lifts are breast reductions. Meaning in both procedures, we're going to lift the breast, we're going to tighten the skin envelope, we're going to reposition the nipples, whether you're having a breast reduction or a lift. But in a breast reduction, we're going to do all that and we're going to make the breast smaller. So yes, if you're having a breast reduction, you're also having a breast lift.
Okay, because I feel like that's a very common question.
Everybody asks that all the time. Like, you're going to do the lift too, right? Yes, we're going to do the lift.
Okay, got it. Can a breast lift or reduction improve nipple position or shape?
Sort of. I think when most people are talking about nipple position and shape, they're really talking about the nipple and areola, what we call the nipple areola complex, because it's all one. We don't typically do much to the nipple itself, but the areola usually gets stretched out in patients who are candidates for breast lifts and reductions. So one of the common questions is, are we going to make that smaller? And the answer is yes. We almost always are going to make it smaller. We can take it down to different sizes depending on patient preference, but in general, we want the areola to match the new breast shape and size.
Okay. Excellent. So last question. Does weight loss or future pregnancies affect the results of a lift or reduction?
That is a good question. It can definitely affect things, but the problem is, we don't have a crystal ball to predict who's going to have what kind of changes. But we do know that typically patients, if they experience significant weight loss, I would say, more than 20 or 30 pounds, that often affects skin laxity. The breast may deflate, get looser, and so there's the potential a patient might need a revision breast lift in the future. If they get pregnant, there's a lot of things that can happen. Some women, when they get pregnant, their breasts get larger and then stay larger afterwards. Some women, they get larger and then they deflate and they're smaller afterwards. So it really depends. So I don't usually recommend patients get breast lifts, reductions, augmentations if pregnancy is something in the imminent future. If it's something 2-3 years in the future, it's a possibility, then you can go ahead if that's something you want to do. But it's definitely something that you want to consider when you're planning the timing of your surgery.
Great answer. All right. Well, thanks to Dr. Arslanian for answering all of our questions today about a breast reduction versus a lift.
No problem. Thanks for asking them, and thanks for tuning in, and we will see you for our next video. See ya.
Bye.